Hi everyone, today I'm going to share some information about our shoulder girdle and shoulder joint. Our shoulder girdle is a backbone attached to our rib cage, and it works with other two joints in the shoulder girdle to create movement, which is sternoclavicular joint and the acromioclavicular joint. These two joints are both guiding joints, and they work together to create scapular movement, which include scapular retraction, scapular elevation, scapular contraction, scapular depression, scapular upward rotation, and scapular downward rotation. Next is our shoulder joint. It is a ball and socket joint, and it permits movement in all three planes of motion, which includes shoulder flexion, shoulder extension, shoulder abduction, horizontal abduction, internal rotation, external rotation. Now I'll be introducing some of the basic palpation skills of the body region I just mentioned about. And also before the palpation, we should also pay attention to any kind of warmth, swelling, and tenderness of specific bony landmark or joint, because it could be a sign of inflammation. Start with the sternoclavicular joint here. So any tenderness of the sternoclavicular joint could be a sign of osteoporosis and also subluxation. These two syndromes will decrease the mobility of the clavicle here, and we could test the mobility of the clavicle by simply pulling it up and down. And after that, we could follow the clavicle all the way to its lateral end, and we will be able to locate its acromion and the acromioclavicular joint right here. After that, we could locate the coracoid process by palpating the infraclavicular fossa, which is right here. And we could confirm the location by bringing the arm into a flexion position, and we could locate the exact bony landmark here. Any pain in this region could refer to an insertional tendinopathy. The posterior side will have our scapula right here. We should first locate our spine of scapula, which is right here. And after that, we could go all the way into the medial side and find the medial border of the scapula. And to its very end, we will find the inferior angle. Now I'm going to introduce two muscles of the specific body region I just mentioned about. The first one is the serratus anterior. Its origin from the upper thigh rib cage, which is right here. So the upper thigh rib cage is on the side right here. And also it inserts to the medial side of the scapula, and it locates into the whole anterior aspect of the medial border. It creates movement of the shoulder protraction and scapular upward rotation. To strengthen this muscle, find a band, wrap it around our armpit, grip the head. Start with pushing our shoulder forward, lift it up, bring it down to finish the motion. So now I'm going to introduce one of the muscles on our shoulder joint, which is the deltoid muscle. The deltoid muscle is composed with 3 different fibers, but today we'll be specifically talk about the medial fiber. It rotates on the lateral aspect of the acromion here, and all the way to the deltoid tuberosity of our humerus. So the major movement of our deltoid muscle is shoulder abduction. And now I'll be introducing one of the easiest way you could strengthen your deltoid muscle at home. To start with, just pick a weight or grab a couple of bottles that filled with water to create resistance. And then next, we have to bring the weight on the side of our body to start off. And we have to retract our back, tuck our chin, and bring our core tight to maintain a neutral spine. And after that, just imagine bring the weight as far away from our body as possible until it reaches parallel to the floor. Bring it back to the side.